My name is Cunningham. I'm originally from Costa Rica, and I'm a PhD fellow at KU Leuven, Belgium, where I'm part of the Migration and Justice Group at the Institute of Philosophy. There I'm pursuing research on the rights differentiation between citizens and migrants, specifically on socioeconomic rights. That, in the context of this project, is that I joined the academy, particularly because some of the rights that are differentiated between these two groups are health rights and the access that migrant workers have to healthcare. That's what mainly brought me here, among other things of future projects that I'm developing. A project I'm currently working is a conference on demographic change and migration ethics. So societies nowadays are facing population challenges given low fertility rates, and migration is advanced as one of the ways and policies that can help mitigating the effects of population decline. And one of the main reasons why population decline is problematic is due to how it challenges the healthcare systems, pension systems. And so joining the academy in a way was a way of getting information of these other aspects that are related with this project that I'm developing currently on demographic change and migration ethics. So for people working on migration ethics or anything related to migration, and also now that I'm turning to population ethics, let's say also these other topics, one of the main challenges is that these are very controversial topics that people sometimes don't like to openly discuss, but also these are topics for which there's a lack of information. Dealing with these problems at a philosophical level and at a policy level requires managing a lot of little details of a very complex environment. So if for people working in the field it's already challenging to be able to know all the different aspects that affect this type of problematics and potential solutions, then the way that we present this to the public, because we have a responsibility to also, particularly if we are funded with public funds, to show to the public what we're doing, it's challenging to do it in a way that it's appealing to the public, that is understandable, and that is able at the same time to transmit the complexity of the issues. One of the key aspects, at least as a philosopher, that I see to overcome these challenges is taking part in events such as the Brocher Academy that offer an interdisciplinary approach to, in this case, a discussion around healthcare. Listening to policymakers, health specialists, physicians, allow us to have a more clear picture of what's at stake. But particularly for me, it has been interesting in this academy is the participation of people that are actually on the ground, seeing how to implement these policies, and that they basically bring academics down to earth by forcing us to see that although our theories or the work that we are developing is quite relevant, we need to also take into account some considerations so that we can make our work relevant to the actual solution of the problems. So one thing that gives me hope is the fact that there's an interest all around the world to keep talking about these problems. And although sometimes in moments of uncertainty, such as the ones we run right now, given the political environment, I think that just looking at the impact that good policies have on people's life is good enough to remain alert and to remain hopeful that the work that we do is going to bring, or can bring results, is already bringing results, and hopefully it will be able to bring more results that provide major well-being to people's life.